Hello, my name is Brandon Ramacco, and today we're talking about exercising the back for sort of chronic back spasms. Typically, chronic back spasms happen to someone who had a disc herniation, let's say in their 30s, and it's still bothering them in their late 30s, 40s, 50s, 60s. They still are fearful of bending forward, and every time they do, oh, back spasms. Or sometimes they do rarely, okay, they have to pick something up, they're in a rush, and they come back up. Oh! Now, the source of pain can be a little complex. Muscle pain, there's facet joints, there's discs, there's the pelvic joints. So I do recommend that you see a health professional for a full evaluation to sort of figure out what source of pain you have, how many sources of pain, they can be overlapping. Keep in mind, though, that sadly, health professionals, once they find one problem, like, aha, that's it, but they might miss that you have overlapping problems, or they might see things through the lens of their specialty. The last 5 patients all had the same problem, so you must have the same problem too. That's just the way sort of healthcare works, and we're all only human. So with all of those caveats, the exercise we're doing today is not for strengthening, it's for neuromuscular control. What has likely happened, or has happened with a lot of my chronic pain patients, is when they've hurt the disc in their back, they sometimes see a physiotherapist or chiropractor that gives them an exercise called directional preference, or something called the McKenzie protocol, which involves repeated or extended back extensions, these full back extensions, which tends to actually be surprisingly comfortable and helpful for someone who has a fresh disc herniation. Either the back bends or sort of these sassy hip type moves, these hip glides, and they can really help. So they're walking in like this, and you convince them to do a few back bends, and they're like, okay, I had my doubts, but it worked. But what we're talking about today isn't a fresh disc herniation. We're talking about chronic back problems. So someone's had something like that in the past. Maybe they were given those exercises, but they've noticed, let's say, that those exercises don't seem to really help anymore for their back problems. And they get back spasms and problems. Typically, they bend forward just like the original injury might have happened. What has happened is they've avoided bending forward so much for so long, their brain has completely forgotten how to control the segments of the back. This segmental control basically moves the back as just one piece. And because it does it so rarely, they end up doing it one day and it's just too much for the brain to control, and it messes up and the joints sort of jostle. And that can pinch the joint. The joint has a joint capsule that holds in the joint fluid, and it can pinch the edge of the capsule, very painful. Might not even cause damage, just the fact that it sort of did a little jerk, it didn't quite move the way the brain wanted, can trigger the pain protection response. Ugh, something weird happened. I better lock things down, spasm muscles. I better send pain to the conscious mind, letting that person know, hey, don't move. Something weird happened. I don't trust you to move anymore. Log it down. Pain every time you move just to make sure it doesn't happen again. So sometimes there's not even any damage. The brain is just being overprotective. So the exercise, this neuromuscular retraining, is to try to combat all of that. Also trying to combat the fear of it messing up. The fear might be also ramping up pain, or at least preventing the pain from de-escalating, the pain sensitivity from staying high. Okay, so typically I have one of these chronic pain patients and I ask them, okay, bend forward. That isn't what I asked. I want you to bend the back. Like, bend this part of the back. And they're like, and they can't do it smoothly. They can throw it. They might be able to do it in one big motion. But if you ask them to do it really slowly, they don't have the control. So we can start with where they feel more comfortable. Just this, ever so slowly. And they can feel the segments. When they feel more confident, Now, they might not feel confident that day. Since this is brain training, the muscles aren't going to tire out. You can practice this as many times a day as you want, as long as your brain doesn't get too fatigued, and you can practice this every day. So maybe they practice the first day, they practice for 30 seconds, maybe a few times a day. Then the next day, they're like, you know what? I don't feel as scared anymore, and it seems to be smoother there. Okay, maybe I'll go just an inch further. Oh, maybe that was a bit too much. No, have confidence. It's going to be fine. This is fine. My back can do this. Okay, right? And every day they can get a little bit deeper. Again, so some patients can basically do this in one session. Some people take weeks. But every time they're getting deeper, and eventually they can even do the motion which they might be most fearful of, which is bending forward with a little bit of a twist and coming back. Maybe even doing a few twists here. Of course, the coming back. Because if the brain is in control, if those muscles are in control, then it's less likely for anything dangerous or painful to happen, and the brain has more confidence. It reduces the pain sensitivity threshold. Just things are better. And of course, better control, you're less likely to actually cause an injury as well. So it's not just fearful of injury, but actually cause an injury. It's less likely to happen. So I hope this is helpful for some of you. Again, when in doubt, consult a health professional, and have a good day. Cheers.